I always say that if you work in rural Africa, there are many challenges, but from my experience over many years working here, the rewards far outweigh the challenges. When we first started working with Hopkins here at Macha, which is now nearly 8 years ago, I told them then that my goal was to get rid of malaria in the Macha area and sort of set a goal of establishing a malaria research institute which would become obsolete in the sense that there wouldn't be any malaria around. My goal is now to take what we've learned here in the Macha area and expand it. We're already in discussion with several other places, both in the country and also regionally in some neighboring countries, to try to work side by side with some other areas which are still seeing lots of malaria. As recently as 2003, we still really had significant transmission of malaria in this area, which would have been considered hyperendemic malaria. We're admitting 40 to 60 children a year with cerebral malaria, several hundred children a year with severe anemia, and seeing up to 90 or 100 children die every year from malaria. That was in 2003, and then over the last 5 or 6 years we've seen very dramatic reductions in our malaria morbidity and mortality, such that this past year, 2009 season, we only admitted to the hospital less than 40 children with malaria, and we had 2 deaths. So seeing that change, knowing that some of that has come about because of our research work and the work we've been doing in the communities, is very rewarding. Something that I probably only dreamed of seeing in my lifetime. As a pediatrician and working in the children's ward here at the hospital, I started working with some other researchers on new drugs. So much of our early work for the first 10 years or so done here at Macha was on new drugs, including the artemisinin derivatives, which have now become standard treatment for malaria throughout Africa. In addition to drug treatment, we've started to do back in the early 2000s, starting to do some epidemiology work in the Macha community, looking at malaria prevalence rates in the local villages, trying to get a better feel for how many children had parasites in their blood, how many people were asymptomatic carriers of malaria, and to try to establish a baseline that we've now been building on the last few years to try to bring malaria under control and bring transmission of malaria down to close to zero in the Macha area. Malaria obviously is not an easy disease to control. And you have to understand the vector, the Anopheline mosquito. You have to understand its habits. You have to understand the local cultural setting. It's not always that easy to just say, let's distribute bed nets, because some people aren't going to sleep under them. I think the advantage we have here is, having worked here for many, many years, this hospital's been here for over 50 years. We know the community knows us. There's that trust relationship. And I think that has significantly contributed to controlling malaria in this area. The question is, can you reproduce that throughout the whole of Africa to get rid of malaria? I'd like to believe it can be done, and we'd like to think of the idea of starting in the Macha area in, say, a radius of 20 kilometers, and then gradually expand that out, getting further and further out until you get a huge area where there's no malaria. Any disease can come back again, so we have to continue to work hard to keep transmission very low, but we think we have tools available now to keep it as low as possible until hopefully a vaccine comes which can then eliminate